It is 8:12 in the morning. It's the voice of Indiana County, WCCS AM 1160 and 101.1 FM. And you can join us on Facebook Live right now for our conversation with Dr. Nazneen Billimoria. Joins us once again during this Breast Cancer Awareness Month. Good morning.
Good morning, Todd. Thank you for having me again.
You're right. We should start just a regular show.
Yeah.
You, me, and Dr. Clark. That's all we really need. Right?
I think so, yeah.
There you go.
Yeah.
Hey, breast cancer awareness. Last week we had Dr. Clark in talking about genetics. I want to get into a more broad discussion of breast cancer, some of the numbers that are out there, the numbers of incidences. I don't know that Indiana County is above average, below average, or average, and the importance of screening
Absolutely.
for cancers.
Todd, breast cancer is the most frequently diagnosed non-skin cancer in women worldwide, and it is the number one leading cause of cancer death worldwide in women. In the United States, it is the second highest leading cause of cancer death in the women. In 2018, there are going to be over 265,000 women who will be diagnosed with breast cancer, and almost 41,000 women who are going to lose their life due to breast cancer. So it's very prevalent in our community, and we have great screening strategies for it. And my main message to women out there today is to get screened. Because the earlier we catch it, the better we can treat it, and the better survival chance you have. About 1 in 8 women will develop breast cancer in their lifetime. So a woman with average risk has about a 12.4% risk of developing breast cancer throughout their life. Mm-hmm. Things that increase women's risk for breast cancer are a prior personal history of either breast or ovarian cancer, a first-degree family member with breast cancer, a second-degree family member as well, and then also if women are carriers of the breast cancer gene, which I believe Dr. Clark touched on last week. So it's very prevalent out there. And we need to get screened for it.
Absolutely. Now, screening is not only much easier, but it's much more efficient and better now than ever before, and especially here in Indiana County at IRMC.
Oh, absolutely. Absolutely. Our Women's Imaging Center has been open for over 10 years, offering, mammograms to women. And just recently, actually, this past Monday, we started something called Mammogram Monday, where women can walk in. They don't need an appointment. They don't need a doctor's order slip. They can just walk in and have their annual mammogram done. And their hours are from 7 to 5. Like I say, you don't need to call ahead or anything like that. You just need to come in and have your screening done. Yeah. So I think that's a great program. And at IRMC, we are also working towards getting nationally accredited for our breast cancer program. And a lot of the things we already do, it's now just a point of putting it on paper and submitting it to the appropriate authorities there.
Now, there is a difference between a screening mammogram and another type of mammogram, isn't there?
Yes, there is. So when women first come in for their first mammogram, it is called a screening mammogram. And that's when they just get general pictures of both breasts and take a look to see if there are any abnormalities, any new mass, any small calcifications that sometimes can be an indication of cancer forming, or if there's anything new that has developed in the breast from their prior mammogram. Now, if this is positive, then the imaging center contacts patients and calls them back for what we call a diagnostic mammogram. This is oftentimes also done in conjunction with an ultrasound. To get a better look at an area that they saw that was a new development in one of the breasts. And it gives us an idea of what's there. Are there new calcifications that we need to biopsy? Is there a new mass there? How large is the area? And if our radiologists feel that the area is new and suspicious, they automatically schedule women to come in for a biopsy. So it's a very nice, very streamlined process for women, very easy, nothing that they have to remember to do. The one thing women just have to remember is to get in there and get their screening done.
Absolutely. Now, density of breast tissue and what you're seeing in that breast mammogram, and you're looking at those pictures, it really makes that initial mammogram, that baseline that's going to establish what your breast looks like on the inside, very, very important, doesn't it?
Absolutely, absolutely. Breast density does absolutely, affect mammograms. Younger women tend to have denser breasts. As we get older, our breasts are replaced more with fatty tissue, and it's easier to see little calcifications and things there. But just because a woman has a dense breast doesn't mean that she should not still have her mammogram. Now, overall, mammograms will miss approximately, 15 to 20% of breast cancers. And that's just the nature of it. But it's still pretty good at catching breast cancers now, because now we also do the 3D mammography, which we offer here at the Women's Imaging Center. And that has also enhanced our capability of identifying these cancers earlier.
Yeah. Now, with 3D, that is such an amazing technology, and IRMC is right there at the top of the list with its 3D technology. It actually, you can tell me if I'm wrong about this, takes it by layers, and you can actually peel back the layers.
Exactly. That's essentially how it's done, and that allows the radiologist to almost better see if there is a new mass or lesion there. Yeah.
So we're talking about breast cancer screenings and screening mammograms. We say annual, and obviously the risk factors are going to play into that. Is there ever an idea that it needs to be more than annual? I'm sure there are certain patients that have histories where it has to be a little bit more than just annual.
Those are most of the time it is just annual. There are very high-risk breast cancer patients, for example, the ones who carry the breast cancer gene. Mm-hmm. Now, they might have two different modalities of screening. They might have not only mammogram, but also breast MRI. And they may get the studies 6 months apart. That way, they're getting a screening study 6 months apart. Now, this is if a woman who has the breast cancer gene has decided that, she doesn't want to undergo a bilateral prophylactic mastectomy just yet. Okay. Now, if you look at screening guidelines, there are several societies and government groups that have all made recommendations on when screening should start, how often should you get it. Some have said start at 40, go every other year until age 45, then you go yearly until age 55, then you go every other year. So depending on what guidelines you look at, they're all slightly different. At IRMC, we are following the National Comprehensive Cancer Network Guidelines, or the NCCN Guidelines. And that is basically a mammogram for every woman starting at age 40 annually until the woman is healthy. Mm-hmm. So even, if they're 75, they're 80 years old, if they're still healthy and they have a good life expectancy at that point, get your mammogram. Yeah. The incidence of breast cancer increases as we get older. A 70-year-old woman is more likely to get breast cancer than a 50-year-old woman. I can't tell you, in my practice, I have treated women over 70, over 80. I have even had 90-year-old patients with breast cancer. So I can't stress how important that is. I'm going to be getting my first mammogram next year. I think for me, I'm just going to make it my birthday month, There you go. My birthday month is going to be my mammogram month.
That's a good plan. I like that. I like that. So take us inside the process. So Mammogram Mondays. Not that Monday's the only day you can get a mammogram. No, but
absolutely not. Monday is just our walk-in days. Mm-hmm. If Monday does not work for you, you can definitely schedule an appointment with our Women's Imaging Center. Their phone number is 724-357-8081. Or you can call our call center, and the call center can connect you to our Women's Imaging Center. The number to our call center is 1-888 452-IRMC. And like I say, it's a very streamlined process. If you need to have a repeat diagnostic mammogram, they're very good about calling you back. And for those women who do get diagnosed with breast cancer, we have a nurse navigator, Dina, in our Women's Imaging Center, who plugs in women immediately with a surgeon to see, either Dr. Clark or myself. We set you up with a medical oncology appointment, so everything is taken care of. So, women don't have to worry about that aspect of their care.
I'm talking with Dr. Nazneen Billimoria this morning, and we're talking about breast cancer awareness. So take us inside the whole process of getting that mammogram. There are a lot of women who won't do it for fear, that it's painful, that it's uncomfortable. Help us to understand the process itself when they walk in for their mammogram.
Okay. So when a woman walks in for a mammogram, she's first going to check in at the Women's Imaging Center. And then, if there's a little waiting period, they'll wait. But then ultimately they'll get taken back to a changing room where they'll change into a gown. And then the mammogram techs will take them back for their mammogram. Now, granted, it is probably not the most comfortable study. I mean, no woman likes to have her breast almost smashed between two metal plates. But the short term of discomfort that it causes with the long-term benefit, I think the long-term benefit completely outweighs that, the slight discomfort it does cause. Like I say, if we catch a breast cancer early enough, oftentimes the only thing a woman is going to need is surgery for it, not undergo chemotherapy or anything like that. Yeah. And so you have your mammogram, and then you leave. And now this is for a screening mammogram. With diagnostic mammograms, women will actually wait until, after their mammogram. The radiologist will look at it and then let them know whether everything's okay or whether they need to come back for a biopsy or something like that.
Okay. All right. So screening mammograms, there's no reason not to have them. There's no excuse not to have them. And the free ones, Mammogram Mondays, that's in effect right now. 7 a.m. to 5 p.m. every Monday, M. Dorcas Clark Women's Imaging Center at IRMC.
Correct. And one more thing I want to mention about that, Todd, is with the Mammogram Mondays, to women who are coming in, I would say if you have had a mammogram before, it is probably better to wait a full year to come into our walk-in clinic, because some insurance companies will pay for a mammogram each calendar year, in which case it doesn't matter if in 1 year you had it in October and the next year you're getting it in May. However, other insurance companies will want you to wait that full year. So unless you know what your insurance company is gonna do, I would recommend, wait that full year from your last mammogram and then come in. You're not going to have any issues.
Absolutely. Thanks so much for coming in to visit with us again.
Thank you so much, Todd.
Dr. Nazneen Billimoria with us here this morning. It's the voice of Indiana County, WCCS, AM 1160, 101.1 FM.